The UK announced a travel ban on the 28th of this month of January, taking effect the following day on the 29th, announced via Twitter through the country's Secretary of State for Transport. The ban excludes British, Irish and third country nationals with residence rights who must self-isolate for 10 days at home upon arrival. Naturally, the decision has sparked controversy. It is clear that Rwanda is implementing measures that were agreed upon globally. For a person to be allowed into the country, they must first take those tests generally referred to as PCL, and I believe here too they are conducted. Such measures are helping to save lives. The UK, on the other hand, is among countries that have not been found to be strictly sticking to the measures to fight the spread of the pandemic. I therefore believe they are not revealing all the reasons they have decided to impose this ban. Why are they not recognizing the measures being implemented here that the entire world has agreed to be effective? Indeed, the UK has among the highest COVID-19 infection figures at around 4 million and more than 100,000 fatalities with more than 2 million active cases. On the other hand, Rwanda has actually been praised for measures taken to contain the pandemic, with slightly more than 15,000 infections after more than 10 months since the first case was identified in the country, and 193 fatalities as of Saturday, as well as 5,121 active cases. The Lowy Institute in Australia has ranked the country 6th globally when it comes to fighting the spread of the virus, and international organizations operating within its borders have openly praised the measures.
The government has taken some action. Rwanda is commended as being a very good example globally in fighting this pandemic. And kudos to health workers and all the actors in that field.
With such facts evident for all to see, Dr. Jean-Claude Byiringiro insists that the travel ban cannot be based on solid scientific evidence. When you look at the information available and where this new strain of the virus has popped up, the figures and so on, certainly the problem is in the UK far more than it is in Rwanda. And that makes you think. With a new strain in the UK and not Rwanda, and infection rates rocketing there way more than they are here, is the ban based on scientific fact or other reasons we do not know about? On Saturday, Rwanda's government released its own statement in response to the announcement from the UK's Secretary of State for Transport, asking for clarifications over the decision when you consider the country's standing when it comes to fighting the pandemic. The statement also pointed out that Rwanda did not hurry to ban UK travellers back in December when the COVID-19 variant first popped up in that country, despite many other nations doing just that.